This week on Capital Connection, the director of the Department of Public Health joins the show to break down the state's new pandemic preparedness plan.
That's right. We are often the victims of our timing and our environment.
And House Speaker Emanuel Chris Welch is being sued by his own staff. The acting president of the wannabe union joins the show to give their case.
We take this very seriously, and we were taking the uniqueness of our position very seriously.
And lawmakers thought they had the solution to the problems the Prisoner Review Board has been facing, but they stalled in the House before session ended. Representative Kelly Cassidy joins the show to talk about that push and why she thinks it all halted.
The other item, the other topic that was going to be a big part of the task force was transparency issues, because that was a common theme.
It's all coming up on Capital Connection.
From the Illinois State Capitol Rotunda, Capitol Bureau Chief Cole Hankey is asking the tough questions. This is Capital Connection.
Welcome to Capital Connection. I'm Cole Hankey. Remember that little global pandemic from a few years ago? Well, now the state believes it has a proper plan for if another one or another public health emergency like it actually happens. The plan outlines clear chains of command for logistical purposes and for just communication when fast action is needed. And it also takes great efforts to modernize a lot of the systems that the state was really lacking and then ended up creating during the COVID-19 pandemic. Joining us now is the director of the Department of Public Health, Dr. Samir Vora. Thank you so much for joining us today.
Well, Cole, thanks so much for having me.
So you are, in August, it'll be 2 years officially on the job. First of all, welcome to the show, because this is the first time I've gotten to talk to you here. But we saw earlier this spring, we saw the state come out with the COVID-19 After Action Report. It was a long-awaited report here just to see how the state kind of assessed, the response to the pandemic and how you're going to move forward on the next potential emergency, pandemic or not, whatever it ends up being. And I wonder, this has been such an interesting job for you to step into, because you really stepped into this sort of review part as much. In 2022, obviously, we're still dealing with the pandemic. There's still, obviously aftershocks of the pandemic going on now, but I wonder, from your perspective, what has it been like to sort of be in that assessor role and that learning role going forward, not for what's going on in the moment as much for planning for the future?
I would say exciting, challenging, complicated, but really meaningful and purposeful. And part of, I think, in many of these roles, right, we are often the victims of our timing and our environment. But I came in, I think, in a really crucial time to start building a blueprint for the present and future. What I like to kind of often say is writing new chapters in the story of public health. And what often doesn't get talked about a lot in a crisis is how complicated and sometimes how long the recovery process is. And what really makes us stronger together is often learning lessons from a crisis and beginning to implement them, so when a future challenge comes, and in this case, a future public health emergency comes, we as the state of Illinois, we as a country are better prepared. And I've made that the core goal and mission of my time under the governor's leadership, and through his vision and priorities to really make sure that we're building a stronger Illinois Department of Public Health and a stronger health system now and into the future.
I think it would take us until maybe the end of your third year in this job to really break down line by line what's in this plan going forward. But really, I wanted to talk about the logistical side of this, because that was such a chaotic part of the early stages of the COVID-19 pandemic. There were mandates being thrown out. There were treatments. There was PPE. There was everything trying to get dispersed, and it was just finding out how things were going to get from here to there was a challenge in so many cases. And I wonder, from that perspective, the National Guard came in very big in those moments, but I wonder, is that a big part of this plan, is just setting up that sort of chain of command in that instance?
And it is. I think part of what we know that was strong from the beginning, right? Strong leadership at the top from the governor, the communication that happened with the governor, Dr. Ezike. But what was not something that any of us throughout the country were used to was a type of public health emergency that required an all of government response. And knowing that a public health emergency, and especially one like COVID, was not the way that we think about traditional emergencies, right? The fires, the tornadoes. Instead, it was a prolonged, right? From the moment in March 2020 to the end of that public health emergency in May of 2023, 3 years. And we know it had different stages, but how to kind of coordinate those things quickly and effectively. And that's why it was really important for the governor that when we did this, of course it was a plan that the Illinois Department of Public Health led, but really one that we were talking to all of those government agencies, aligning those things, and really putting a playbook, one of those things that came from the after action report, one that we could pass to the next administration that really took a strategic approach around exactly what you're talking about, the ways of working, the logistics in terms of what we need in-house to prepare for, but what are all the government processes that we have to turn on and turn on quickly, because we know that in whatever future challenge may come about, speed will be critically effective. And I think we saw some of those things in the way. My first day, August 1st, 2022, was when the state declared a disaster declaration around Mpox. We also saw just earlier this spring the challenge of measles in Chicago. And although we had the highest cases that we've had in 30 years, we were able to respond to those things so quickly, right? We were able to call off the Mpox public health emergency, and just over the past 2 weeks, the city of Chicago and the state of Illinois were able to declare that the measles outbreak was contained based on that public health quick and effective action.
Whenever it was interesting to see how the ladder would climb in these instances, I would talk to a local Department of Public Health here, like Sangamon County, for instance, or Macon County, and they would often talk, sometimes they were at the whim of what the state would do, in some of those cases. And I know there were frequent times that we saw the governor and Dr. Ezike at the time really call on the federal government for help in that. And that's such an interesting part of this. Is there only a certain amount of planning the state can do, based on its own powers? And is there just always going to be that kind of acting by the whim of the federal government in this sense too?
I would say that it has to be a partnership. And one of the things that I have talked a lot with our local health department leaders, and even having those conversations with the federal government on the Health and Human Services side, lots of engagement with the Centers for Disease Control and Prevention, is that we have to have a unified vision and understanding of this, right? To some degree, we know that what the CDC is doing every single day across and monitoring. I had a recent visit. I was in the CDC Emergency Operations Center, right? They are looking at countries across the world, understanding when those diseases will be at risk for us domestically. And we have to depend on that. We have to depend on their surveillance systems to a certain degree. But it doesn't mean that the state shouldn't be doing everything in its power to be prepared. And that's been a big number one priority for the governor, to making sure that we are leading here and leading on a whole bunch of issues. And then how do we create that partnership with the locals? And part of this, that we know that was a challenging time, federal, state, local. Everybody was trying to make complicated decisions with limited information. And we're working and talking, meeting. I've been on a number of road trips and continue to sort of plan to visit our 97 local health departments and building big, broad initiatives together. Just in April, as part of our 30 Days of Public Health, we launched a public health transformation initiative with the locals. What I learned there was this is the first time in nearly 40 years that locals have been brought in by the state to do visioning, strategic planning together to prepare for the next public health emergency, but also do the everyday things so we uplift the public health workforce and are modernizing our systems together.
I wonder with this, you had already mentioned the idea of taking this playbook and even passing it on to the next administration, or maybe the next administration after that. But there's always that conversation of, obviously, in the aftermath of something as impactful, as massive as the pandemic, there was going to be that response. There was going to be that push to kind of build back up. But how do you, and can you now, take steps to maybe way down the road try to prevent those kinds of tearing down actions that we saw happen to the structures that were in place for something like this pre-COVID?
Yeah, and I think we think about this often. We talk about it in the public health world. We are having incredible successes every single day that the general public doesn't notice because nothing happened. Right? Their water was safe. Their milk was pasteurized. There were no food outbreaks in their restaurants. And all of the things that we do, like vaccinations that prevent those diseases, and even when we have them, like Mpox and measles, they can make a lasting change. Part of this, and one of the things that really sort of the report is, right, we got to improve our preparedness. We have to really think about modernizing our systems. But the last part of it is investing in communities and building the communication and trust building strategies that are necessary. And part of this, and thanks to you, Cole, for inviting me on, is that yes, part of it is the public health director and the governor or the CDC director and the president talking about these things. That will always be important. But what we really need to do is kind of uplift the everyday stories in our communities and how important public health is every day to make sure that people can live the happy lives that they can, preventing certain illnesses, and then also providing the right access to care to make our healthcare delivery system strong. And that's been critically important in the ways that we've been engaging in some of our communication strategies.
And those communication strategies, obviously that's there for making sure people understand the importance of this, but does that go hand in hand with trying to restore the trust in these systems? Because we saw, obviously, during COVID, there were, the initial reactions, and then it seemed like every kind of new, not initiative, but kind of new directive along the way seemed to lose more and more people at that point. And then it got to the point where there was the vaccine everybody had been waiting for, and people are choosing voluntarily just not to take it. And I wonder, when we're talking about that public trust element to it, is that the same process, or is there additional steps that need to be taken there?
I think part of it is we know that building that trust will take time. One, I think it's a reminder of the achievements that are happening. Two, how do we create that personal connection? But part of this, and one of, yes, I'm the director of the Illinois Department of Public Health, but in this state that comes with the tag of being, Illinois' top doc too. And part of that sort of gears me back to my pediatric practice, right? I didn't always have the right answers at every single moment during some of the most challenging patients that I had. But what I did and showed through the things that I was getting right along the way, and the careful conversation and the fact that I was by my patient's side, to make sure that during the highs and the lows that they knew that they had an advocate in their doctor for what was in the best interest of their child. And part of that is bringing that energy will take some time into the Illinois Department of Public Health, that we serve 102 counties in this great state. We have 6 regional offices, that we are working with our local health department counterparts to be honest about what's going on, to be mindful that what we're recommending is in the best interest from a scientific and a health base, and then being there every step of the way. And that's slowly going to earn the trust. Part of that we talked about, the recovery process will take time from the crisis, but almost everything that we are building and sort of discussing as part of our approach into the future has that trust building at its core, knowing that it'll be a marathon, not a sprint.
Got it. Well, Dr. Samir Vora, thank you so much for joining us today.
Well, thank you so much. My pleasure.
We'll be right back.